The Omicron wave is letting up in some cities and states that were hit first by the variant. But Dr. Anthony Fauci says Omicron may not be the end of the pandemic. He told a virtual panel for the World Economic Forum new variants could squash that hope. Meanwhile, school district officials in Oakland, California say they've met most of the student demands for better COVID safety protocols. This comes before a boycott planned for today by the students. CBS News' Michael George has the latest.
Omicron-fueled COVID cases are still surging across the nation. More than 5.4 million Americans tested positive last week, a new record. But the story is changing in New York City, where numbers are dropping fast in both cases and hospitalizations.
We are winning. You sent a clear message that vaccinations and booster shots are successful.
New York was one of the first places hit hard by the variant. And while the city is improving, health experts are warning COVID is here to stay.
If you look at the history of infectious diseases, we've only eradicated one infectious disease in man, and that's smallpox. That's not going to happen with this virus.
At-home testing is considered a key tool in the battle against the virus, but those tests are still hard to find in some places. Tomorrow, the White House is launching covidtest.gov, a website where Americans can order free tests.
Tests allow us to make decisions about whether we're contagious and so a threat to others, whether we can safely return in person to school or to work.
The tests will be limited to 4 per household and are expected to ship within 7 to 12 days of ordering. Michael George, CBS News, New York.
Let's bring in Dr. Jerry Abraham, Director of Vaccine Programs at Kedren Health. Dr. Abraham, welcome. Great to see you again. So LA County, where you are, is seeing the highest COVID death rate in 10 months, and that comes to around 40 COVID deaths a day over the past week. So tell us what you're seeing on the ground, and to what do you attribute this growing death toll?
Yeah, I think while we know that Omicron is less severe but much more contagious, it still seriously impacts the health, especially of our elders and our sicker members of society, our families, our community. And so while for many of us, it may just be a cold, another respiratory bug, for some, this really is a matter of life and death and whether you're going to be admitted to the ICU. We do have treatments that help, but they're very few and far between, and it's very hard to get with long wait lines for monoclonal antibodies that work against Omicron. And of course, now we have Paxlovid and Molnupiravir, but these are not a panacea for what we're seeing right now, and that's going to continue to inundate our hospitals, and we'll continue to see these deaths until Omicron rates decline. Thankfully, those numbers out of New York are encouraging that perhaps the end of at least this wave of Omicron may be in sight.
And, you know, Doctor, a study out of Israel is indicating that a 4th COVID dose provides limited defense against the Omicron variant. And the FDA has acknowledged antigen tests have a reduced sensitivity in detecting Omicron. So does all of this tell us we have to essentially start over when it comes to making new vaccines and tests to detect not only Omicron, but future potential variants that react similarly?
Yeah, we really were optimistic that this 4th dose may really help boost our levels of immunity and protection against Omicron. So it is discouraging that 4th doses may not be the solution. We do think that for some immunocompromised, very vulnerable people, going and getting that 4th dose may be helpful. And so we'll continue to do that and monitor the research. However, I think it's imperative that we look to Pfizer, Moderna, Johnson & Johnson, AstraZeneca, and others to make sure that we get next generation vaccines that actually are effective against the current strains and variants. But as Dr. Fauci mentioned, you know, we're just another strain away from a very serious wave, and that is alarming and concerning. So let's get through this 5th wave, the Omicron wave. Let's be vigilant come this spring, summer, and then, of course, next cough, cold, flu, and COVID season in this fall and winter. And I think those variants are what to watch. We don't really know where we go with COVID after this. And, of course, that pandemic versus endemic debate rages on.
Of course, and looking forward, like you said, we look at the next flu season, 2023, right? Moderna is working on a booster shot to target both COVID and the flu by fall of 2023. However, is it a little too early? Is it sort of like the flu shot in that we just don't exactly know what strain we'll be dealing with that far into the future?
We know that you do have protection when you're vaccinated, even with the current existing vaccines that we have. It's just not optimal. So that's true of the flu shot as well. You may get vaccinated against the flu and still get the flu. However, what we're really excited about is that you don't die or get hospitalized by catching the flu. So ideally, we would like to have optimal, ideal vaccines that prevent you from getting sick at all, keeping you entirely asymptomatic or not even getting infected. However, the reality is that vaccines are not a one-stop shop. What they're really good at is keeping you from dying and from being severely ill. And I think it's very encouraging that we move forward to new vaccine technologies and platforms where we can combine the flu shot and the COVID shot and provide people, that optimal protection. But 2023 is a long way off, and we're really going to have to watch how we go through 2022. 2023 fall, that's great. But what are we going to do fall 2022 is the question.
So how do you suggest we prepare then? Because we can't sort of, stand still. I know getting vaccinated obviously is the most important thing to do right now. But what else should we be thinking about and planning for as we look into the future?
Yeah, I think we're going to have to continue to build sustainable COVID infrastructure. We're going to need one-stop COVID shops, COVID centrals, where got COVID, need a test, need a vaccine, need therapeutics. People don't even know where to go. They go to their physician's office, and their physician's office may not know how to get these therapeutics or monoclonal antibodies. You go to the emergency room, and you're looking at a 3-4 day wait in the emergency room if a bed ever becomes available. So this is definitely a dire healthcare crisis. And I think one of the solutions is to make permanent some of this public health infrastructure that we've been building over the last 2 years. So we really need COVID testing centers, COVID vaccine centers to become permanent, and we need to learn to live with COVID, including regular testing. And when there are exposures, we need to be ready to quarantine, isolate, and make decisions in the workplace, in schools, in churches, so that we don't spread this virus any further. Every time there is an outbreak, we really risk encouraging new strains, new variants to emerge. And we want to be extremely vigilant and mindful of that.
Dr. Jerry Abraham, great idea, one-stop COVID shops. I think that is the future. Thank you so much for joining us. We appreciate it.
Thank you for having me.